Hey everybody, Dr. Dan here with Beacon of Life Chiropractic, and we have Adam here with us this evening. And Adam has chronic low back pain as his chief complaint, and really for him he describes it as just a throbbing pain in his low back, especially when he lays down. And as a basketball player, he's had to sit out in the past from basketball games and not be able to contribute to the team, so it's really affected his life. And I want to show you torque release technique adjustment here to address what's going on causing that low back pain with Adam. So you can lay down there, Adam, and we'll get to work. Okay, so, all right. Now, with the torque release technique, what we're looking to do is take the stretching and the tension off the spinal cord. And the way that we do that is we adjust the bones at the top of the neck and the base of the low back and hips, where the spinal cord itself actually attaches right to the bones. It doesn't attach to all the bones in the spine. However, it does attach here specifically to a few bones in the low back and hips and a few bones at the top of the neck. So you can think of it just like a guitar string, and if you have a guitar string and you turn the one end of a guitar string, it's going to change the tone of that whole chord, you know? So basically we're tuning his guitar string here to take stretching and tension off the spinal cord. So we need to find where we need to adjust first. All right. The first bone we're going to adjust is actually the sacrum bone, and it's right here in the middle of the hips. Good. So this instrument, it's called the integrator, and it delivers the adjustment very quickly, very fast, boom, just like that, real quick, boom, just like that. So it's a very gentle force, but it's quick. So what that means is that force equals mass times acceleration. So to get force, I can use more mass to give a big heavy adjustment, or I don't need to do that. I can actually use more acceleration here with this instrument very quick to get the same amount of force, but I can pinpoint very specifically where we need to adjust and not move anything that we don't want to adjust, okay? So I'm gonna explain to you as well how this low back pain typically comes about for folks, because we see it all the time, unfortunately. It's very common, but it's not normal, meaning there's something causing the low back pain. It's not normal, although it's common. So the deal is this, is that these bones in the hips, you have the sacrum in the middle, and then an ilium here and an ilium there. They're the bones that rock back and forth when you walk, or they're supposed to. And that SI joint, the sacroiliac joint, there's one on your left and one on your right, and that's where those bones articulate or join up with each other. And what happens, for lack of a better term, is that when these bones are misaligned, they get stuck and they're not moving correctly. And when they're stuck or they're subluxated, it creates inflammation and swelling to accumulate around the joint, and it irritates the nerves in that area. So that's really what's going on, and we're working to address that. So, you know, Adam doesn't have low back pain from a lack of Advil. You know what I mean? There's always a cause to it. We're going to adjust a third segment here as well. So the third segment is actually at the top of the neck. Again, just like tuning a guitar string. Beautiful. And you can come on up, my friend. Good. So here's the thing, is that, you know, these bones, they don't get misaligned and subluxated overnight. It takes time for that condition to develop, and it takes some time and repetition for that to get corrected, but that's the process of healing. It doesn't arise overnight, and healing takes some time and repetition. But Adam, you're doing great, my friend, and it's good to explain this to you guys. I want you to understand, you know, that when you have symptoms, they don't happen for no reason. It's not by accident. It's your body telling you, it's giving you a warning sign that there's an underlying cause going on that's producing that symptom. Dr. Dan here with Beacon of Life Chiropractic. We'll see you next time.